Welcome to Mind Amendment, the podcast that dares to challenge the ways that we think about mental health, physical health, addiction, and healing. In part 2 with Dr. Jessi Gold, we talk about the pressures to seem fine. Follow Dr. Jessi Gold and tag someone who needs to know that even doctors aren't immune to burnout. We're back here with Dr. Jessi Gold. So welcome, even though you haven't gone anywhere, but we're starting part 2. We had a great break. And audience, welcome back this week. Hopefully you did your homework from last week. If you have not watched or listened to last week's episode, part 1, go back and do that before you tune into this one. Trust me, you will not regret it. So today we are talking about rebuilding identity after burnout and allowing vulnerability as a path to healing. We're going to start off with a game. Again, is this something you'd say to a friend? So I'm going to read these statements of harsh inner dialogue, and you're going to tell me if it's something you'd say to a friend or not. You're falling behind.
No, I probably wouldn't do that.
You can't tell anyone how overwhelmed you are.
I wouldn't say that either. I'm a big oversharer.
Everyone else is handling this better.
Yeah, that's horrible. That would make you feel really bad.
You wouldn't say that to a friend?
No.
Okay. If you quit, you're a failure.
Oh, yeah, I definitely wouldn't say that to a friend.
So, Dr. Gold. What's a piece of self-talk you had to unlearn to get your life back?
Yeah, I mean, it's good we started with the would you say it to a friend game, because we do just never say the things that we say to ourselves. If we actually heard them, we would never be friends with ourselves. Like, it would just be impossible. I think I go very quickly to like a small mistake meaning something really big, like I'm a failure, or like who even let you do this job in the first place, like these big things. And like I've had to really push myself to one perspective take that like a small thing is not a big thing all the time, but also to like pause and hear the way that I talk to myself, which is hard because it's kind of like you have to sort of force it because our brains don't want to think about what we're actually saying to ourselves in our head. But if you pause and you go like, what did I just say? And why did I say that? And how
is there
would
anything
I say
that catches you that you've learned to like stop in your tracks to do that?
That's a good question. Certain like big statements, I think, like that I go quickly to. So like if you ever did cognitive behavioral therapy, those sort of like big kind of statements you're trying to get to through cognitive behavioral therapy, I think a lot of this, like, I'm a failure, I'm worthless, I'm a bad person, like these things that like are at the core that you would be working a lot to get to. If I ever hear one of those are like big red flags. Smaller red flags would be that like I'm not actually doing the task. I start spiraling in my head. Like, so I'm like looking at my computer, but I'm like thinking about the 75 ways that like this is problematic for me, or that it meant something about me. And if I'm not actually doing the thing I'm trying to do and I'm really in my head, that's a sort of littler red flag for me to be like, why are you there? Get out of that and more into yourself.
Which that's a form of executive dysfunction, right?
Yes.
Okay.
I think so.
Yeah.
I mean, I also think like probably my therapist would tell you I'm not like very embodied of like feelings. Like I have them, but if you were like, what does mad feel like? I don't know that I could like describe that very well to you. And it would
like physically?
Yeah.
Oh, I hate it when my therapist loves to ask me that question.
Yeah. And so I do think there's like a bit of like executive dysfunction in that, but also sort of like, how do I get, like, I don't want to be here. I want to be outside of my body in some sort of like overly intellectualized way where I'm just like thinking about the thing instead of feeling the thing, or even like, you know, being present with the thing. And so that's also a big thing for me. If I sort of feel like I'm trying to get away from something, that's usually a warning sign that like I need to stop that and like sit with it for a second, which is miserable, but true and needed.
Has it been through, I mean, so what you're talking about though is definitely like, it requires a level of insight that does not come natural. So like, is that something that you've had to work through with your therapist to identify how to recognize those scenarios you just described?
Yeah, I mean, I would say 100%. Like, I don't know that I would be able to do any of that stuff without like working on myself and having self-awareness, because a lot of those things are subtle. Like, I don't want to feel big feelings, so I go for a run, or I go like talk to a friend, or I do something else, or I go make a task that is something different, right? Like, I don't know that I would notice I was doing that in order to avoid something if I hadn't spent a lot of time talking about it.
Wait, but those are all good things that take care of yourself and are self-care.
Self-care. It's true, because you also can rationalize that, right? Like, I went and exercised, I'm great, but like, why? Like, sometimes there's a why that's the first thing you go to that's important. I think, yeah, without therapy, I wouldn't really be able to recognize it as much, but also like, I just want to also say that it's like a total work in progress too, right? Like, I wish I could tell you like, oh, I've figured out how to be like compassionate to myself at all times, and I'm like really healthy, and I talk to myself like a friend all the time. I do not do that. Like, I've worked hard on a lot of this stuff, but very regularly backslide and very regularly still miss stuff in the context of like harder work or life or lots of things going on. And like, even sometimes like my therapist will be like, I know someone who wrote a whole book on that, right? And that's like not great to hear, because I had to write a book on some of this stuff, you know, and you're like, oh yeah, I guess I should listen to myself, right? But it's important for people to realize that like, these things, like, even if you go to therapy and stop going to therapy and aren't someone who needs it all the time, like I feel like I do, it's a practice that you'll always have to do.
Well, and if I might add to that, I think it's so important because I've had to be a mega consumer of both medical medicine, biological, physical medicine and mental health. And, you know, first, I think that lesson, that valuable lesson was driven home for me of, I mean, we hear medical practice all the time. I never thought about until my brain surgeon, long story, but was telling me in one of our long talks, and he was like, you know, Patrick, it's called practice for a reason. Like, it's always going to be that. Like, hopefully that'd be great, but like, you know, and I mean, I was 30 years old at this point, and I think I'm not the dumbest person in the world. It was like something exploded in my brain, this aha moment of, wait a second. Cause we tend to, those of us in like regular society I think many of us tend to have this, like, we look to, you know, mental health professionals and especially doctors, MDs, as, you know, knowing so much more, having the answers, whatever. And not to say that everybody, I have this theory now though, that like, no matter how much skill that has been developed and books have been read, there's still a level of winging it that we're all doing. And I mean, and so where I'm going with that is the comparison to, I learn things through metaphor, literally only. Mistakes and metaphor are the only two ways I learn things. So I've started to look at mental health as, to the point that you were just talking about, we still have, you know, accidental, intentional overdose and intentional suicide like crazy. To me, it's the like mental health's version of cancer. I hope I hope I'm not offending anybody by saying that, but if I had to like compare physical malady versus the mental health side, you know, like we've made so many advancements, and yes, there's so many things that can help, and will help, but things get missed. Mistakes are made. Not every doctor is perfect. Not every provider is you know, does that mean you should give up as a consumer or a provider? No, by all means, no, you know? Yeah. And so I don't know. I hope that analogy means something to someone listening or watching out there, because I think that whether you're a professional or a consumer, like I said, like you can say it all day long, but I think we have to be reminded that on the consumer side, don't lose hope just because a provider maybe said something that was off the cuff, or, you know, whatever. They're human. Maybe you need to find a new provider. If you're a provider and you had a really bad day, or like what you described at the very beginning of this series, learn from it. And look, like we're having all the good that's blossomed from that. So I think there's like a multitude of lessons.
Yeah, I mean, I think it's like I don't have the expectation I will never burn out again. Like that's not a realistic expectation. What I've realized for me is that the growth and the change is that hopefully I see it earlier and I don't blame myself for it. Both of those things I didn't do before, because it was like, how dare I burn out? Only like people who can't keep up with their crazy schedules like burn out. And then also like I didn't recognize it until it was really bad. And so for me, like I approach work, and especially the kind of work that I do, like, of course I'm going to burn out. Like, it'd be so weird if I never did. But hopefully I won't get to the place where, like, I need to take time off work for it. Or I will hopefully be able to say, like, this was a bad month. Like, reset.
You mean taking time off of work is intentional to take care of yourself rather than the result as a consequence of
100%.
Sorry, in my head I'm like, wait, let me clarify for my brain as I heard that.
Yeah, like as a not to just have a vacation, but because you have to,
yeah.
Right? And I think we so often like approach these things like somehow you could just like never have it happen again. And I think the healing and the growth and the real strength in it is that like that's not realistic. Like relapse is a part of recovery. Like I think that it's similar, you know?
This is a straight left turn, but also it's totally related.
Yeah.
I'm just curious if you just in your pocket have a theory about this. Why do we as a society, I mean, I feel like you can apply this to everything. We are so dualistic. Like it either is this way or that way. Like getting any of us to look at things from like understand gray is like, no, like, and it's rampant. Like whatever profession you're talking about, whatever religion you're talking about, whatever. I mean, do you have a theory from
why that is? I feel like it has to do with like how school approaches things, how like you're supposed to raise kids. Like I think it like things are good or they're bad, or things are, you shouldn't do that, that's not appropriate, but that you can do that. Or like we have grades and there's good grades and bad grades, there's good words and bad words. Like I just think it starts really early in this like labeling. There's good feelings and bad feelings. So there's like labeling of that, and maybe it's grounded in like religion in some capacity, because there is like very clear duality in that and not a lot of nuance in that, especially in a lot of the religions that sort of like a lot is based on. But I'd hate to say it's just religion, but there's always that undertone, I think, for a lot of folks, in sort of where morality comes from and things like that. I wish we were better with nuance. It's part of why we can't communicate across differences, because it's hard to sort of perspective take when you think there's only one right answer. And I don't know, mental health professionals are good at this because we see everybody. And that's just like how our jobs were designed, is like that we can understand other people, where they're coming from, empathize with the feeling, even if we don't empathize with the story. And I think that's just not taught well or valued. And it's probably why we are not very good at communicating with other people. And it's not a positive, in my opinion. Like, I love nuance. I live in nuance. And I think it's really lacking, especially now. But I would imagine it's been like that for a while. It just feels more obvious now in a lot of ways. And
I think it has, I would throw in there, I feel like it has a lot to do with the last 9 years. We've gotten to a place where everything is so polarized. Everything. And I miss the times when I didn't know. There's not someone in my orbit that I don't know their political. I don't think. I mean, there might be some sleuths out there that, I don't know if I just used that word correctly or not, but that are stealthily, keeping it hidden. I would say 99% of everyone I'm remotely close to, I'm aware. And I miss the days where, because back before then, there were plenty of people I knew that I didn't know, I didn't need to know, I didn't want to know, because there were so many other ways that I was able to connect to them. And I love connecting to people through, like what you said, nuance and the feeling rather than the... but it feels so loud that getting through the noise and the pressure of that, the black and white of it all, it feels almost impossible today.
Yeah, I wish it didn't feel like that. I wish I had a really good answer for how some people might not feel like that, but there's probably privilege in my answer. But
how do you because I'm not a licensed mental health professional.
Yeah.
People think I am all the time because I host these shows, and I've just been working in it for so long and can speak a lot of the language. But this is something that I would be very curious to understand. If there's is there a go-to that helps you do what you just described, which is to push that to the side and get to connect with a person over the feeling? Because y'all are having to do that right now.
Yeah. I mean, some people won't, and there's a big debate about that too, right? Like, I don't want to see anybody who's different than me in X view or Y view. And there's a lot of conversation in the mental health sphere around whether that's ethical or not. I'm not going to get into it because someone on listening will get mad at me for whatever I want to say. But that's a big conversation, and I get where it's coming from in some capacity. But I think it's curiosity, really genuinely wanting to know something about a human and not assuming that the labels are all that defines the human. Yeah. And that's asking deeper questions, that's listening and validating the whatever it is, right? We don't always have to be we have friends, we should have friends that we don't always agree with. Yeah. And we should know how to still love and value them as people, even if we disagree sometimes. We should know how to do that, and it's an important skill. And I think for me, it's there's something in there that is interesting about that person always. And part of what drew me to psychiatry, it's part of what drew me to anthropology before psychiatry. I like people, and I like people's stories, and I like that I could hear 100 stories of depression, and maybe ultimately they all get the same medication or the same class of medicines. But what brought them to me and how to help them in the long run is much more complicated and different than that. And it's not boring, but I think it's a curiosity that maybe people don't have as much anymore because they shut down, and they're sort of oh, I'm not going to there's no way I could possibly listen to that person or care about what that person has to say. And I don't really have a choice. So they're there. It forces me to do it. But it's also like a good challenge, to be honest. It doesn't mean it's always easy, but I think it's a good challenge of sort of like finding the commonality and finding the interesting bit about a person, or just really genuinely respecting people as who they are as humans, and knowing that like not everyone's going to agree with me at all points, and nor am I right all the time. Right. And that matters. And so I don't know if it's something I learned through training, or whether I was raised that way, or whether training made the way that I was raised more
chicken or the egg,
you
right?
know, but I think it's really just like a genuine curiosity.
I love that. I'm a very curious individual, so I'm gonna work on flexing that bone and thinking about what you said. This podcast is brought to you by Promises Behavioral Health. If you or a loved one are struggling with trauma, addiction, or mental health, we are ready to answer your questions and help you take that next step. Call our admissions center at 888-648-4098 or visit us online at www.promises.com. Our team is ready and waiting to answer the call for help. You talk about the danger of internalizing shame for being human.
I mean, the danger of it is that we become not human, right? Like in some way, by penalizing ourselves for having feelings, or saying, oh, like you're fine, or you're okay, you don't need to cry, that didn't hurt, whatever it is. We feel bad for crying, or we feel bad for having a reaction, and we think it's weak or something's wrong with us. And then we shut it down more until we're like really not a person as much as we're sort of like a worker bee, or like a shell of a human in some capacity, or a bit of like a robot. But, you know, I think part of the reason I'm not a robot or AI is because I have feelings, and we shouldn't shame ourselves for that. But society, I think in general, doesn't know what to do with feelings. So I like Mr. Rogers was awesome, but like a lot of people aren't, right? Like if you watch that show, like, I mean, the way he talks about stuff, I mean, he's so brilliant about that kind of like feelings and community and all of it. But most of us are taught very differently. Like I can't tell you how many people cry in my office and the first thing they do is apologize
for crying.
Yeah. And you're like, I'm a psychiatrist. If you can't cry here, like where are you crying, right? But I have the same reaction. Like if I was at work and I felt overwhelmed, and I sometimes like I cry when I'm angry, and I can't, that's something sometimes you just can't control. And like your first, like at least for me, my first reaction to that is like, oh no, like how dare I do this, like someone's gonna think blah about me or whatever it is. And we try so hard to just not do it and apologize for it, or like think it means something bad about us. And like I don't know why we shouldn't do that. I mean, if we don't have control over it, they're just like, it is what it is.
Yeah.
Sometimes there's a time and place for that, and that's true sometimes, but shouldn't be never.
Yeah. Amen. I mean, there's nothing to add to that. It's so well put. When patients worry about being too much or not enough, what's your clinical approach to guiding them back to self-compassion?
Yeah. I mean, that's also a message we get. I think it depends. It's like can be gendered. It is also just this like, oh no, nobody can deal with me. Like the feelings I have are too big for someone to deal with, and they don't.
There's a terminal uniqueness to that.
I'm gonna scare them away. No one's gonna want to be around me. I wouldn't be friends with me. And it's just there's so much like I don't know how anyone can handle me, right? Because you feel that way about yourself a little bit. You know, I think it's understanding what that means to them, like where that's coming from, and really like talking about it, right? Because our first reaction is sort of the same way with the self-compassion thing, right? It's like we go right to the big thing. Yeah. Like I'm a bad person, or like I shouldn't do this or whatever it is. Like, it means X, Y, or Z about me. Instead of like really being like, what's that about? Like, why am I doing that? And there are lots of reasons we do that. And it's important to understand it to change it, I think. Like, I obviously go to a lot of therapy, but like, I just don't think you can approach these things by going like, it's just something I do, like, let's do a skill to fix it. Like, I wish that was true, but I think that there's like, the skill has to also be based in like some degree of understanding of the origin. Does that make sense?
Yes. I've been going through, I mean, like, I've been in an orbit, not only at Promises, but just like in my whole realm of operating, of pushing skills, which are great, and talking about them and the necessity, because I think we're coming out of an era where so many people did so much CBT and talk therapy and virtually no skills were involved. But I love what you said about skills without insight behind like what you're doing, why you're needing the skill it's like, that just blew my mind for a second, because in my head, I'm thinking like, well, duh, like I have a problem, therefore I'm going to find a skill in order to help with the problem. But underneath the problem is actually more of what we got to talk about than just
because sometimes in that way, like, a skill's a Band-Aid, right? Like it probably helps. There's a reason it helps. But if like you don't know why you're doing that thing, you're gonna keep doing it. Yeah. Like, it might not be, you might be able to fix it for a time period, but something else is gonna happen. Your reaction's gonna be the same because you were taught, or whatever makes you have that reaction. If you don't actually address like the core reason it's happening, it's sort of a Band-Aid. And I think a lot of people like that kind of therapy, like, because skills are tangible and there's something you can do and it feels like you're doing something. Talking about why you feel a certain way doesn't feel like anything to people a lot of the time. It feels like, well, why do I go there and talk about that thing? Like, who cares? Like, fix it, and there's validity to that. But I think you have to do both.
Yeah. Yeah. So good and so true. How do you personally navigate the fear of disappointing people, especially as someone who is public facing and a mental health expert?
I'm not a people pleaser, but I am an overachiever. And some of that's internal and some of that's familial. And still familial. And so I have to check myself a lot to ask like why I'm doing something, in that like, am I doing this for me? Am I doing this for like someone else or someone else's recognition? I think that's hard to do, but it's important for me, especially in sort of like growth. I think it's really easy to get caught up in doing things for other people. Like, I sometimes, like a good deal of med school, I was like, did I go to med school for me, or did I go to med school because I was taught that being smart and good at science means you go to med school? And that's a really hard thing to figure out when you're already in med school, because you gave up a lot already to get there.
You just hit something super deep, and I know that's not just for me. Now, med school is obviously something that's a much longer, deeper commitment than many of us make professionally, and much more expensive, emotionally, monetarily, all the things. Yeah. But what I think is really relatable for all of us is the what if of, and looking back and saying, like, why, ruminating on what was my purpose for, like, was my purpose genuine, and does it align with yada yada yada? And we live in that land of, did you ever land on a, like, what your answer was? Truthfully,
by the time I started reflecting on...
No, give me the media appropriate answer. I'm just kidding.
I mean, truthfully, really, like, in a lot of ways, I liked psychiatry better than med school, and I figured out that I could do things that made me happy within the thing that I already chose. And in some way think that I was supposed to get through it to help other people get through it. But if I went back and did it all again, would I do the same thing? I don't know. I think that I got through it. I convinced myself to stay in it. There was some invalidating of my like experience to get there, sort of like, well, you're here, keep going. But I think ultimately it was like sort of, it is where I am, and it was the choices that that was the path I went on, and how do I make that path now actually actively my choice, right? Like maybe that whole bit of time was some mix of me and other people, but like now everything I'm doing is me. I'm here in doing what I want to be doing, and I disappoint people, I think I do at times. Like I think I grew up in a family that doesn't talk about a lot of the things that I talk about publicly. And sometimes they're like, why did other people need to know that? And there's truth probably for them, and even other people knowing that about me when they then see those other people too. It's like I'm a product of them or the rest of my family. But I'm okay with some of that disappointment now, because I feel like I'm doing what I'm meant to be doing and figuring out what I like to do and why it matters to me. And that's been a hard thing. So,
I feel like that alignment, or what feels like potential misalignment, lends itself to alignment later if we allow it and keep going. Because who can't relate to, I feel like people are lying if they say, I'm just a planner. I knew I wanted to do this, and I did this, and then I had this plan and I was following through with this. If you say there was never a point where I continued on doing what I was doing, even though I had doubt, but I just had to keep going, because what do? Just stop. We've all been at those places in life where you're talking about professionally, or the fact that you have kids and you wake up and you don't want to do the day at all, or a relationship. Like whatever. That is so applicable. And I think that there's a lot of power in what you said, of that. Like we could waste time sitting thinking about like the what ifs, or take the experience and determine how it can best serve us today. Living in art.
100%. And I think we somehow view questioning as a problem. Like, if you are in medicine and you say, should I be in medicine? You're somehow like breaking the covenant of the profession, and like you're challenging all of the things that brought you there in the first place. But I think questioning is probably the best thing you can possibly do. So whenever I'm talking to students or like, people along the path, I'm like, if you don't stop and ask yourself every once in a while, like, do I still like this? Why am I doing this? What brought me to this? Like, that's healthy.
Yeah.
And if the answer is like, I hate this, I don't want to do this, change is really hard, especially in like, a profession that is so much of your identity. But if it's wrong for you, it can still be wrong for you, no matter how much time you gave to it. And so I think when I think about even like looking back how I would have done things differently, is I think I would have like valued my questioning more strongly. I might have still ended up in the same place, but I really judged myself for questions, or the way that people responded to my questions was very like, I took it as a challenge. Like they'd say, well, you always wanted to be a doctor. It's just like the classes are too hard. And then I'm like, well, no, they're not. I can do the classes. You sort of fight back with staying with it. And I should have really taken it more seriously. Like I had a therapist in college who was like, write down every profession and tell me like why you don't want to do that profession, because I'd always want to be a doctor. And I didn't take it seriously at all. I was like, I did the assignment, but it was very like, she didn't push me because I don't think I was ready for it. But it was like, I don't want to be a teacher because it's not medicine. Like it was very like concrete. Like I want to be a doctor. So it wasn't that, or it's not the same or whatever. But I didn't really sit and go like, what about teaching would I like? And is that in medicine? And again, it sort of gets back to values, but it's also like, where do you get enjoyment? And like, we don't really think about that. Like we just kind of go through these paths of career selection, and then that becomes our identity in some way. And like, I think if I was to do it again, I would have like taken that assignment seriously. Yeah. But I also would value the pauses in the questions and not blame myself for them. And like, if the answer was like, hold on, wait a minute, you're not sure, I would go, okay.
Have you done that exercise now as an adult?
Oh, I'd be like a little scared to do it now because I feel like I'm way in. Like it feels like if the answer was, maybe you should be a doctor, I'd be a little bit far in. But I haven't. No, I think I'm a little terrified of what it would be, just because in taking my own advice, I would need to listen to what the answer would be.
Well, thank you for sharing your human side once again with us, Jessi. Okay, you say I am, after all, trying. What does trying look like in the messy middle? Not cured, not collapsed.
It means that sometimes things are hard, and sometimes you have big feelings, and sometimes things aren't perfect, and that's okay. It means asking for help when you need it and not blaming yourself for it. It means telling the truth to someone in a way that is scary, because being alone with it is worse. It means valuing myself for the messy and the middle, and not saying like that's a problem or a weakness or something that makes me other or not as good. I think,
because let's qualify really quick.
Yeah.
If we're talking about the middle,
Yep.
We've already identified the thing or the things. We're starting, maybe we've like worked on it. We're in the sludge of like the feels about the whatever. And so I think framing that like mindset as somebody's listening to you to say these things right now is helpful.
Yeah. I mean,
And
I see it as sort of like being a work in progress.
yeah.
I mean, I think the messy middle is like realism, right? Which is that we're never going to get it all figured out, and that's okay. And also, like, even if you're recovered or cured or whatever, like we're kind of talking about, like you can backslide, you can have bad days. I also think there's like a recognition that like a bad day doesn't have to be burnout, or it doesn't have to be depression. Like you can just have bad days.
Yeah.
And I think there's more ability to sit with that when you're in like the messy middle, to be like, today just was bad. Like it doesn't mean all of my days are bad. It doesn't mean I'm all the way back here again. It just means like, well, it was a day and it was bad, and now what? That's, I think, how I think about it.
I love that. All right, so wrapping this episode, do you have any? Because I didn't come up with any suggestions. So any homework for our audience for between this week and next week, from the things we've talked about in this section?
I mean, I think you could do something like what my therapist wanted me to do when I was in college.
I love that.
I think it's scary. If you're like far into your career and the idea of like questioning your career, it terrifies you. Like I'm a little terrified by it too, but I have a bunch of careers now, so I sort of feel like I'm not 100% a doctor, which is also nice. But like, you know, ask yourself like more about your job and your choice of it, or challenge yourself to think about other professions you might enjoy and why you won't do them because you like what you're doing or whatever it is.
I love it. Awesome. Thank you, Dr. Gold, Jessi. And audience, thanks for sticking with us. Come back next week with your homework or without your homework. But we will always have you, and can't wait to go through part 3 with you. Join us for part 3, where we dive into perfectionism, gender norms, and why women in healthcare are expected to hold it all without falling apart. This podcast is brought to you by Promises Behavioral Health. If you or a loved one are struggling with trauma, addiction, or mental health, we are ready to answer your questions and help you take that next step. Call our admission center at 888-648-4098 or visit us online at www.promises.com. Our team is ready and waiting to answer the call for help.